On June 5, 1981, 5 homosexual men were diagnosed with a rare lung infection. These infections would mark the first recorded cases of AIDS in the United States. Over the next 40 years, 88 million people would be diagnosed with the virus, and over 40 million would lose their lives to the epidemic. The virus known as HIV, or human immunodeficiency virus, attacks the immune system, weakening it and making the body more susceptible to other diseases such as pneumonia, as well as creating an increased risk for heart disease. If left untreated, HIV can transform into AIDS, or acquired immunodeficiency syndrome. Treatments for the virus vary. However, there is currently no cure for AIDS. The AIDS epidemic created a standard for protecting the rights of those in crisis, while highlighting the responsibilities of healthcare workers, the government, and the general population. President Ronald Reagan didn't mention the word AIDS publicly until 4 years after the initial cases in 1981. Criticisms of his administration's silence and lack of funding for AIDS research were fueled by the burgeoning epidemic that had taken over 3,500 lives by 1985. The Reagan administration had withheld funding for the World Health Organization during the 1980s, which subsequently led to the worst budget crisis at the time, during the early stages of the AIDS epidemic. His delayed response had been heavily criticized as there is no action from him until October 2, 1985, which is when he allocated $190 million for AIDS research. There was a negative stigma surrounding AIDS, which was facilitated by the public view on homosexuals. The New York Times dubbed it as gay-related immune deficiency, which furthered the idea that only homosexual men could have the disease. Another one of the main groups that was affected were drug users, as sharing needles was a common way the disease was transmitted. In an interview we conducted with AIDS activist Mary Fisher, she recalls her message to those who didn't think they could contract AIDS in her 1992 speech, Whisper of AIDS.
I also asked for people to understand that AIDS was not a disease, just a gay disease. It was a disease of all people, and anybody could get it, and how we couldn't discriminate and we couldn't hate people for having this disease, and that was a big thing for me.
Many people believe that they were not at risk of developing AIDS since they were not included in the primary groups affected. However, HIV, the virus that causes AIDS, can infect anyone through the exchange of bodily fluids such as blood. This created a significant risk for hemophiliacs, people whose blood doesn't clot, as they often relied on blood transfusion. Fear of the disease caused a multitude of issues for people diagnosed with the disease. Many of those afflicted with AIDS were prevented from participating in society. Ryan White, a teenager with hemophilia from Indiana who contracted AIDS from a blood transfusion, was denied entry into middle school due to his AIDS diagnosis. His appeal to attend school raised national awareness, as he fought for his right to attend school. He would gain the ability to attend middle and high school until his death in April 1990. A similar story occurred in Florida, where the Ray brothers Ricky, Robert, and Randy, who were also hemophiliacs, contracted the disease from a blood transfusion and were barred from attending school. Many families and groups in the community did not want the Ray brothers to attend school out of fear that they would spread their disease. The family would later sue the school district of DeSoto County and win, which gave their kids the right to return to school. The discriminatory acts against the Ray family would not cease, however, as the family's house was burned down a week after winning the lawsuit, and some parents took their children out of the schools as a boycott against the federal judge's decision. The fear also caused some doctors to refuse care altogether. Dr. Schmall, the chief of St. Luke's Hospital's Department of Thoracic and Cardiovascular Surgery, would test patients for AIDS. If they were positive, he would refuse to operate on them. He stated that he had to be selfish due to his responsibility to his family being more important than his responsibility to his patients.
As healthcare workers failed to provide an environment where people with AIDS could be treated, one hospital in San Francisco created Ward 5B, an environment created to exemplify compassion and care for those affected. Founded by nurse Cliff Morrison in 1983, Ward 5B was the first unit of its kind in the nation. Instead of isolating patients with AIDS, the workers in Ward 5B took a different approach, treating them humanely. The workers in Ward 5B didn't wear protective gear and provided human touch to their patients. They showed HIV could not be transmitted through casual contact, which disproved the common misconception regarding the disease. Despite a lack of treatments available and silence from the government, units like Ward 5B provided hope in the AIDS epidemic. It wasn't until 1987 when the American Medical Association declared that doctors had an ethical obligation to treat those with AIDS as well as those who are HIV positive but show no symptoms. In 1990, Congress enacted the Americans with Disabilities Act, the ADA, which prohibits discrimination against those with disabilities, including those who are HIV or AIDS positive. As the epidemic raged on, levels of activism and protest grew. Celebrities such as Magic Johnson, Eazy-E, and Freddie Mercury came out publicly with their HIV-positive diagnosis, which pushed AIDS into the international spotlight. The issue became harder to ignore as large-scale protests spread across the nation. Activists founded organizations such as the AIDS Coalition to Unleash Power, or ACT UP. In 1988, around 1,500 ACT UP protesters disrupted the FDA headquarters demanding shorter drug approval times, inclusive testing on all groups, and free access to medication trials. Meanwhile, Elizabeth Glasser, who contracted AIDS from a blood transfusion, created the Elizabeth Glasser Pediatric AIDS Foundation to raise funds for pediatric AIDS research after tragically losing her 4-year-old daughter to AIDS after transmitting it via breastfeeding. These groups provided healthcare to underprivileged people who had AIDS. They pushed companies to accelerate testing and lower the cost of medications.
Ricky Ray, one of the Ray brothers, became an activist, showing the unpleasant side of AIDS.
Ricky can't eat solid foods. He can barely drink. He can't even sit up. But he has a lot he wants to say while he can. Here's his message to the newly elected president.
I hope he does what he says about AIDS. And I know he's a pretty busy man right now because he's got to run the United States now. But I'd like to speak to him on the telephone.
You want him to help? What do you want to tell him?
I'm telling him that I want help for AIDS.
As activists pushed for policy regarding AIDS, politicians started to pass laws to protect the rights of those who were HIV positive. Legislation in early days of the AIDS epidemic was not passed by committees, and funding for AIDS research didn't occur until 1983. Legislation slowly rolled out as the Americans with Disabilities Act, ADA, passed. The Ryan White CARE Act was created in 1990 to help families cope with the impact of AIDS. The funding for the CARE Act has continued to present times despite authorization expiring. In 1998, the Ricky Ray Hemophilia Relief Fund Act was enacted by Congress, which authorizes payments to those with hemophilia that contracted AIDS from blood transfusions. These legislations gave support and solidified the rights of those affected by AIDS, ensuring the protection of their health and providing security. Over 40 years after the first 5 initial cases in 1981, the AIDS epidemic continues to rage on around the world. In 2023, there are 40 million people living with HIV/AIDS, with over 1 million new cases of people contracting the disease that year. Over 500,000 people lost their lives to AIDS in 2023 alone. Many who are HIV positive are underserved and don't have access to health care. Regions such as sub-Saharan Africa are hit hard, with over 60% of new infections in women being from the region. There is hope, however, as the rate of new infections has dropped by 60% since the epidemic's peak in 1995, and AIDS-related deaths have decreased from their peak in 2004 by 69%. New treatments allow for people who are HIV positive to live a long life and not have the diagnosis be a death sentence. The world has come a long way in terms of treatments and stigmas surrounding AIDS. The AIDS epidemic showcased the impact of healthcare workers and activists, reminding us that the fight for human rights and responsibility belongs to all of us.